there's a new Health Appropriations Subcommittee member in the upper chamber. The Centers for Medicare and Medicaid Services reverses course on planned Medicare Advantage reimbursement changes. And lawmakers return from congressional recess with a long to-do list. For the week of April 13th, 2026, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
Now, and CBP agents are being paid, even though TSA is not, and that's because we pre-funded that from last summer. And so I think that, coupled with the fact that we also have possibility of a budget reconciliation bill, if we need to plus that up.
Kicking off this week's episode with news from Capitol Hill, where lawmakers are returning from spring recess this week and are expected to focus on funding for the Department of Homeland Security and a path for the next budget reconciliation bill. President Donald Trump and Senate Republicans have reached an agreement on the outline of a fast-track spending bill that would focus on immigration and customs enforcement and customs and border protection. It remains unclear if Republicans in the House of Representatives will also coalesce around this approach. The president has called for such reconciliation legislation to be signed into law no later than June 1st. DHS has been operating under a partial government shutdown since February 14th, the longest partial shutdown in U.S. government history. In related news, congressional health committees have a busy schedule of hearings planned this week, including a House Ways and Means Committee field hearing to examine how a modernized approach to health care can better prioritize wellness as part of chronic disease prevention and incentivize innovations in care delivery that improve patient outcomes. There will also be a hearing in the House Energy and Commerce Subcommittee on Health on legislation addressing various areas of public health, including disease research and prevention efforts, bolstering resources for rural medical services and healthcare providers, promoting healthy activities, and increasing access to care. And lastly, a Senate Health, Education, Labor, and Pensions, or HELP committee hearing will be held on prescription drug affordability. Chairman Bill Cassidy, a Republican physician from Louisiana, has said that the proceedings will focus on how to increase competition among generic and biosimilar manufacturers. Congressional hearings on fiscal year 2027 budgets have also begun. The House Ways and Means Committee will hear testimony from U.S. Department of Health and Human Services Secretary Robert F. Kennedy Jr. on Thursday morning. Secretary Kennedy will then appear before the House Appropriations Subcommittee on Labor, Health, and Human Services on Thursday afternoon. Stakeholders are invited to submit witness testimony on the fiscal year 2027 Labor, Health, and Human Services Appropriations bill no later than Thursday, April 16th. The LHHS Subcommittee has tentatively scheduled its appropriations bill markup for June 5th.
We're going to bring people onto the ACIP panel, not anti-vaxxers. We're bringing people on who are credentialed scientists, who are highly credentialed physicians, who are going to do evidence-based medicine, who are going to be objective, and who are going to follow the science.
Shifting to news from the administration today, where the U.S. Department of Health and Human Services Secretary Robert F. Kennedy Jr. has signed an updated charter document for the Advisory Committee on Immunization Practices, or ACIP. The charter, which guides the mission and makeup of ACIP, is renewed every 2 years. The 2026 amendments broaden the range of expertise for individuals qualified to serve on the committee to include issues such as toxicology, biostatistics, immunology, family medicine, nursing, pediatric neurodevelopment, and recovery from serious vaccine injury. ACIP's previous charter required its members to, quote, have expertise in the use of vaccines and other immunobiologic agents in clinical practice or preventive medicine, have expertise with clinical or laboratory vaccine research, or have expertise in assessment of vaccine efficacy and safety, unquote. This change may allow the Secretary to circumvent a recent federal court decision blocking the ACIP appointments made between June and January of 2025. The new ACIP charter also includes language specifying that the committee should advise the Centers for Disease Control and Prevention about the gaps in vaccine safety research and adverse effects following vaccination. Several new organizations are made eligible to participate as liaisons to ACIP under the new charter, including the Association of American Physicians and Surgeons, the Independent Medical Alliance, the Medical Academy of Pediatrics and Special Needs, and Physicians for Informed Consent. Back to Capitol Hill today, where Senator John Husted, a Republican from Ohio, is replacing Markwayne Mullin, a Republican from Oklahoma, as a member of the Senate Appropriations Subcommittee on Labor, Health, and Human Services. Husted also serves on the Health, Education, Labor, and Pensions, or HELP Committee. Mullin was recently confirmed as Secretary of the Department of Homeland Security. More news today, where the Centers for Medicare and Medicaid Services has finalized a 2.48% net increase to Medicare Advantage payments for 2027. The increase amounts to a $13 billion payment boost for Medicare Advantage plans for the coming year. The final rate notice is a significant increase compared to the 0.09% originally proposed in January. The advance notice received record-breaking 40,000 comments from stakeholders. Upon finalization of the Medicare Advantage payment rate, Senate Finance Committee Ranking Member Ron Wyden, a Democrat from Oregon, issued a statement expressing disappointment in CMS's decision. Wyden said, quote, "While insurance companies get billions in higher payments and their stock prices soar, American families are stuck with record-high premiums and deductibles, all to pay for care that's locked behind more and more barriers." Unquote. Winding down today, where the Medical Group Management Association, or MGMA, has released its 2026 Regulatory Burden Report. MGMA's survey of more than 230 physician groups found that 95% of providers faced higher regulatory or administrative burdens over the past 3 years, with 77% attributing those burdens as a cause of physician burnout. The report ties 3 of the top 5 burdens, including prior authorization, claims denials, and downcoding, to the Medicare Advantage program specifically. 90% of practices surveyed have seen a patient shift to Medicare Advantage, with 79% characterizing the shift as having a negative impact on their practice. The report also highlights Medicare reporting requirements as a burden on physicians, with 86% of respondents saying that physicians are heavily impacted by the merit-based incentive payment system's quality reporting requirements. Final news today, where the Centers for Medicare and Medicaid Services announced last week that participants in certain Innovation Center models may begin offering a new Substance Access Beneficiary Engagement Incentive, or BEI, starting April 1st. Through this optional incentive, eligible hemp-derived products can be incorporated into patient care plans under clinical guidance. The Substance Access BEI will be available to participants in the ACO REACH model and the Enhancing Oncology model, and will be available to participants in the Long-Term Enhanced ACO Design model beginning in 2027. Under the Substance Access BEI, participating organizations that elect and receive CMS approval may furnish eligible hemp-derived products for up to $500 per year per eligible beneficiary, subject to model requirements, safeguards, and clinical determination.
Good morning and welcome everyone to the organizational meeting for the 119th Congress.
And I welcome everyone to the first HELP Committee meeting of the 119th Congress.
Good morning and welcome everyone to the first meeting of the House Committee on Energy and Commerce of the 119th Congress.
The Finance Committee will continue its long tradition of addressing these matters in a manner that invites bipartisanship.
We end each week's episode with the call to order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, On Tuesday, April 14th at 9 a.m., the House Ways and Means Subcommittee on Health holds a field hearing titled Modernized Healthcare and Practice, Empowering Americans to Live Healthier Lives. Second, on Tuesday, April 14th at 10 a.m., the Senate Commerce, Science, and Transportation Committee convenes an executive session to consider several bills including the Stop the Scroll Act, the Mental Health and Aviation Act, and the No Fentanyl on Social Media Act. Third, on Wednesday, April 15th at 10 a.m., the House Oversight and Government Reform Subcommittee on Government Operations hosts a hearing entitled Fraud Prevention, Understanding Fraud in Federally Funded Programs Run by the States. Fourth, on Wednesday, April 15th at 10:15 a.m., the House Energy and Commerce Subcommittee on Health gavels in a legislative hearing titled Healthier America, Legislative Proposals to Improve Public Health. Fifth, on Wednesday, April 15th at 10:15 a.m., the House Education and Workforce Subcommittee on Workforce Protections holds the hearing Building an AI-Ready America, Understanding AI's Economic Impact on Workers and Employers. Sixth, on Wednesday, April 15th at 2:15 p.m., the House Veterans Affairs Subcommittee on Oversight and Investigations hosts a markup, including several health-related bills. Seventh, on Thursday, April 16th at 9 a.m., the House Ways and Means Committee convenes a hearing featuring Health and Human Services Secretary Robert F. Kennedy, Jr. Eighth, on Thursday, April 16th at 10 a.m., the Senate Health, Education, Labor, and Pensions or HELP Committee hosts the hearing Making Medicines More Affordable, How Competition Can Lower Drug Prices. Ninth, on Thursday, April 16th at 10:15 a.m., the House Veterans Affairs Subcommittee on Health gavels in a markup, including a number of health-related bills. 10th, on Thursday, April 16th at 2 p.m., the House Appropriations Subcommittee on Labor, Health and Human Services, Education, and Related Agencies holds a budget hearing for the U.S. Department of Health and Human Services. And last, on Friday, April 17th at 9 a.m., the House Education and Workforce Committee holds the hearing Examining the Policies and Priorities of the Department of Health and Human Services. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.